So I'm the president and CEO of a long-term care community, a CCRC, with 500 residents. I may repeat a little bit of what Adam said because it's critical. And I want to first thank the senators that spoke today about the high level of urgency for vaccinating all of our residents in long-term care. This has been the most challenging year that you can ever imagine. We had an outbreak in our community in April. You'd come into work in the morning and not know how many more residents had died from COVID. It spread through our community at an outrageous pace, despite the fact that we were taking temperatures 3 or 4 times a day. We were doing everything we possibly knew to prevent the spread. Other communities have had outbreaks as similar. I don't know another CEO that hasn't had an outbreak on their campus. We live in fear every day because every day has the potential of being another outbreak. The vaccine is our hope. When we heard that we were the top priority in the United States for getting the vaccinations to our communities, we were so appreciative of that. And yet that has not really been what has transpired. Unfortunately, our residents have lived with constant shutdowns. We shut down, then we're able to open for a brief period, just a few visits at great distances away, but mostly our residents have lived isolated from their families. They've been secluded from not going to dining rooms. In November, we had a positive case in our skilled nursing employee and a positive at the same time in personal care, which meant completely shutting down all visitation, all meals outside of a resident room, and all activities. So our residents face Thanksgiving dinner eating a takeout meal in their room, isolated from the world. Some of the residents are 95 or 100 years old. Some of them are World War II veterans that fought for our country, and we couldn't get them the vaccination quick enough. We begged our families who were devastated at the fact that their families could not get the vaccine. We begged them to have patience. We were top of the list. We would get the vaccinations quickly. And finally, we did get a date that we would have our first vaccination clinic on January 4th. We believed at the time, we were told that personal care and skilled nursing residents would have that vaccine as well as employees. Unfortunately, a few days later, we were notified the Department of Health said that we were not allowed to have personal care residents vaccinated. I don't understand that. We have people that are 103 years old and have, I know facilities that have had huge outbreaks and deaths in personal care. We continue to try to advocate, call everyone we know, trying to get clinics. Finally, we received an email saying that we would have a clinic for personal care on March 8th. That infuriated me. How could we, in any conscious way, say that having a clinic that late, having people isolated for all this time alone in their rooms, and that we would think it was appropriate to have to go all that time before they could be vaccinated? I think Adam referred to the point that those facilities that speak out sometimes get vaccines. I was interviewed on NBC in Philadelphia, and a few hours later got a call that I would in fact get vaccinations for my entire community on January 24th instead of March 8th. I am extremely grateful for that, and our residents are so happy you can't imagine. But I spoke a week later with 12 CEOs from other facilities across Pennsylvania that have not had those vaccines. So again, we have individuals that are in the highest rate they could die tomorrow, and we have to find a way to make them a priority. I know Grandview Hospital close to me received 2,000 vaccines late in December, and within 3 or 4 days vaccinated 1,900 employees. We have to have the same urgency to vaccinate our residents. We are about to finish all 3 clinics that CVS has allocated to us for skilled nursing. Our last date is later this month. Our last date for personal care clinics will be, I think, the first week of March. We have residents move into skilled nursing every day. There are no future plans for how those individuals get vaccinated. We have people move into personal care every day. How will they get vaccinated? We have independent living residents, again, that are over 100 years old. We have 400 independent living residents on our campus. The high majority do not drive. The high majority have no internet connection. They do not have smartphones. They cannot manage trying to figure out how to get a shot. I had one resident drive 40 minutes up to Lehigh County because they could get a vaccine. I'm speaking for all senior living communities that I know. All independent living residents must be vaccinated on their campus. When CVS speaks to the fact that, well, they'll have clinics in their centers, we don't have a way to get 400 individuals to a CVS store. We have all the facilities. We can vaccinate people. We have pharmacists that come on our campus regularly. We have physicians, we have nurses. All we need is the opportunity to get the vaccine and to protect our residents. I appreciate very much you giving me the opportunity to speak.